Okay, I am thrilled that BDD has been added to today's program. And so thank you, Carolyn, for doing that. And I just want to start by publicly and personally thanking Dr. Phillips for myself and for so many people who suffer from BDD. You have been nothing short of a hero. And sorry, it makes me kind of emotional to talk about it now, but thank you very, very much for all you've done. So I have 15 minutes to tell you my life story and how to treat BDD. So I better get started. And why are my slides advancing? All right, I'm going to start with some pictures. This was me at the age of 18, before my BDD surfaced. This was 1972, I believe. And like many people at that age, I wanted to grow my hair long. I wanted to be like the rock stars of my generation. And so in this picture, the only thing that probably concerned me is that my hair might have been a little greasy. But other than that, I wasn't really worried about my hair. But suddenly, about a year later, I remember this as if it were yesterday, taking a shower, washing my hair, and seeing a ton of hair on my hands. Now, was it there the day before? I really don't know, but I noticed it that day. But that day I thought, well, all right, that's unusual. Let's see how the next day goes. Well, the next day was the same thing, and so was the day after. And so at that point, I panicked. I thought I was losing my hair and losing my hair quickly. I, in fact, went home to my mother. She right away took me to a dermatologist. The dermatologist took one look at me and said, "You got to be kidding me." And so back to school I went, and I must say I coped very well, but I had developed a lot of obsessions and a lot of compulsive behaviors too. I decided that, all right, I liked my hair long, but I didn't like seeing in the brush anymore. So what did I do? I decided that I wasn't going to comb it. And so I would just let it go naturally. And so this is what happened as a result. This was just 1 year later, after my BDD symptoms had surfaced. I wasn't combing my hair. I wasn't getting it cut. Well, I was getting it cut. The problem was I was doing it to myself. And you can see why I became a psychotherapist instead of a hairstylist. I did not do a very good job of this. But you know, somehow I did remain functional. I graduated college, went to graduate school for my MSW. So you know, I found a way to cope. However, I always knew one thing. I always knew that if I in fact lost my hair, I would have to kill myself. I know that seems odd when we talk about a body part, but that's exactly how I felt. So I continued to grow my hair long, and I like to, this was my last year in college. You can see that I must have majored in Frisbee, although my real major was psychology. But one of the things I like to point out is that that is a tree behind me. It's not all my hair, but that is much of my hair. It didn't, however, stop me from believing that my hair was falling out. My beliefs were so strong that nobody, and I mean nobody, could talk me out of it. All right, so that's it for the pictures. As far as likely precipitating factors for me, you know, I won't go into all of these in detail, but there were a lot of events and circumstances in my life at the time that probably contributed to BDD developing. I don't doubt for a moment that there is a neurobiological element to BDD, but I have to believe the stressors that I was experiencing also were contributing factors. The ones I'll highlight here are my own personal history of having been abused as a child and also neglected, and also receiving a lot of attention when I was a child because of my hair, which even at the age of 1 or 2, my hair, I don't remember, but my hair was kept long, it was curly. And I did receive a lot of attention because of it. And that certainly continued as I got older. And as I wore my hair longer, it only really complicated things for me because I became the guy with all the hair. So it really became part of my identity. So in the process of my recovery, much like Ethan discussed earlier, I went a very long time from the onset of my symptoms to getting proper treatment. In fact, I believe it was 22 years. And I think I went, there was at least a decade and a half, I think, between the onset of my symptoms and body dysmorphic disorder even being a recognized term. So I just thought I was like anybody else my age of not wanting to lose their hair. I do want to mention that the obsessive, at the time, what was called the Obsessive Compulsive Foundation, which is now the International OCD Foundation, really played a very, very significant role in my recovery. I had gotten their newsletter probably from really the very beginning, maybe not right at the beginning, but they founded in 1986, and I was getting their newsletters shortly after that. And I always found their newsletters to be really interesting. All this talk about OCD, and I just assumed I had OCD. You know, everybody told me I was obsessing about my hair, and so it made sense. The problem was when I was reading these newsletters, and I was also leading 2 support groups on OCD, nobody was ever talking about a body part. And so it was interesting, but it never seemed to resonate with me. Well, that all changed. And Kathy, I don't know if you remember the date of this, but I believe it was you who wrote a newsletter article on BDD. I think it was the cover article. I read this thing and I could not believe it. She was describing me to a T. The obsessional thinking, all the compulsive behaviors, the mirror checking, the depression, the self-isolation. It was all me. And so this was before the days where everybody had email. So I made copies of this newsletter article, sent it to members of my family around the country. And to a person, they all said the same thing. Yes, this is you. Now I was left with the thought of, all right, now that I know this, what do I do? That wasn't so easy because I didn't know any doctors who knew anything about BDD. When I would see a therapist, when I would see a psychiatrist, when I told them what I was going through, I heard sometimes OCD, which was understandable. Sometimes I heard panic disorder because I did have panic attacks sometimes. But nobody knew anything about this. And finally, I did see a psychiatrist who I believe has some connection with Stanford. He may have been a professor there at the time. And I showed him this newsletter article and I said, look, you know, we got to treat this. You know, he kept on giving me a diagnosis of OCD, which frankly, at the time, I think that treating BDD was probably exactly the same as OCD, but I wanted him to use the right language. And so together we learned about BDD and I did get better. I, you know, tried some medications. I took Zoloft. It was a high dose, not as high as some of the doses that Dr. Phillips mentioned, but I think I eventually got to 250 milligrams. And it did help. And frankly, I took Zoloft for probably 25 years. At times when I didn't take it, times when I got better, I thought, I don't need this anymore. And a few months later, my symptoms came roaring back. So I learned a lesson. And for me and many other people, not everybody, but many other people really need to stay on these medications for extended periods of time. So as we talk about therapy, I just want to start with the point that Dr. Phillips also mentioned, which is plastic surgery, as well as dermatologic treatments, are just not a reasonable option. Now, I know it seems like an easy fix, and I know it's understandable to think that way. I mean, frankly, you know, if you're somebody who believes that your nose is misshapen, your first thought's not going to be, well, maybe I should see a psychotherapist. I mean, I understand that. Your first thought is going to be, well, I'm going to get this nose fixed. The problem is, if we know that if you feel that it's BDD and we understand that it is, the surgery can't work. I mean, why would it? I mean, BDD is a psychiatric problem. It's not a physical one. And so we know that on those rare occasions where when people have plastic surgery and they do get a little better, another body part shows up. And that only makes sense. You can't just remove a psychiatric problem with plastic surgery. So I do what I can to try and dissuade people from surgery. But what I put here on the bottom, I think it's my job. I see it as my job to give the facts about how plastic surgery is likely to go for somebody with BDD, but I tread softly. And what I mean by that is that a lot of times people with BDD see plastic surgery as the key to their recovery, not just recovery, but to the key to their life satisfaction. And so I'll say to people, all right, I understand that you want plastic surgery, but how about giving therapy a try for 3 months, 6 months? Let's see how it goes. And then we can talk about it then. And taking that approach, I think, is a softer way to address this issue. I have seen horror story upon horror story about people having plastic surgery and then afterwards chasing additional procedures to try and correct the initial one. And at some point wishing they had the body part look the way it did prior to the surgery. Okay. As Kieran talked about earlier, a lot of the treatment with BDD as far as therapy can be very similar to OCD. There's, in my experience, there may be somewhat of more of a role for cognitive therapy, balance distorted thoughts and beliefs. Exposure therapy is very, very important. I think that really leads to the breakthroughs by challenging beliefs and confronting maladaptive behaviors and coping strategies. The problem is, just like in OCD, this is really hard work. And so you do need a therapist who is very skilled in this. As far as cognitive behavior therapy in general, to me, the goal with BDD is we want to try and weaken the beliefs associated with physical appearance. And people really need to be able to learn that life can be meaningful without altering or disguising body parts. And we need to be able to confront the belief that, our happiness and life satisfaction is linked to physical appearance. So many people I know, and this has been true for me, is that our day will go sometimes based on how our day will go, will be based on how we look at any given day. Look good one day, have a good day. You don't look good the next day, it's terrible. That's not the way life is for most people. Now, what I put here as an important goal is that ultimately feeling good has to be more important than looking good. And I know that sounds really overly simplistic, but what I mean by that is that you got to do the hard work of therapy. You got to do the hard work of the exposure therapy to get better. And you have to put that ahead of trying just to look better as a way of managing these symptoms. So behavior therapy strategies. My friend and colleague, Ari Winograd, likes to talk about the 6 p.m. rule as far as mirror checking and the arm's length policy, which I think are very important. The 6 p.m. rule being, if you're at home at night, you're not going out, if you're looking in the mirror, the greatest reason for that is probably the BDD. And so if you're doing that, you leave yourself wide open for problems. And so if you're home for the night, you don't need to look in the mirror, don't do that. The arm's length policy is that there's no reason to climb up on the bathroom cabinet and get this close to the mirror. When anybody does that, we're going to see things we don't like. And so try to keep an arm's length policy, a normal distance from the mirror. I don't have time to go into the various sort of behavior therapy strategies or exposure therapy strategies because, we would put together a hierarchy, deal with the more difficult items first, move on to the easiest items first and move on to the more difficult ones later. For me, one exposure exercise was, I would avoid seeing hair at any cost, whether it's hair on my clothes or in the brush. And so instead of doing that, I had to look for them and maybe sometimes wear my hair in ways that I felt to be less attractive. It would cause a lot of anxiety initially, but over time it did diminish. Muscle dysmorphia is a form of BDD in which people believe that their body build is too small or too slight. And so exposure therapy may involve resist working out one day or omit part of the exercise. As Dr. Phillips mentioned, a lot of people with BDD are concerned about skin. And so if some of this is regarding, let's say, acne, perhaps an exposure exercise is to go out with either less makeup on or maybe none at all. If concern is about the weight and it's not an eating disorder, perhaps the person wears tighter clothes, which doesn't conceal their body size. A lot of people with BDD have concerns about their teeth. and may speak to people, making sure that they don't expose their teeth or cover their hands, even cover their mouth even. I would encourage people then to go talk to somebody without engaging in those kind of behaviors. So I'm getting short on time, so I just want to highlight a few things. As Dr. Phillips said, body dysmorphic disorder is not OCD. And one of the things I've learned over the years is that it cannot be treated as OCD. Yes, there is a lot of overlap, but we do know that with BDD, a lot of people experience these issues. That's why I often say in my talks that everybody seems to have a story. Now, I haven't met everybody, so I can't say that for sure. But certainly in the people that I meet a lot of people who have a history of abuse, neglect, have been bullied and teased, often about physical appearance, and often have grown up in families where there is a unusual focus on physical appearance, and frankly, on success and exceeding in ways that maybe is really unrealistic. And so my feeling is that if these issues are in somebody's background, it does need to be explored in therapy. Otherwise, I think the person will only get better to a point. And so I think we need to understand how these issues may have contributed to the development of BDD, and maybe even more importantly, how they continue to affect somebody's life today. All right, so some things that I've learned. BDD is a psychiatric problem. It really has nothing to do with how I actually look or how anybody actually looks. I think many people who have actual flaws don't feel as bad as those of us with BDD. I've come to recognize that people care about who I am as a person. I really doubt that when I'm meeting with my clients, anybody has come in and said to themselves, you know, Scott's hair doesn't look that good today. I don't think I'm going to see him. I don't think that's happened. Just because I have beliefs about the importance of hair, that doesn't mean that other people feel the same way. So that's an important cognitive strategy. And I also need to understand what's happening in the moment. I don't always think about my hair. I'm not always obsessing about it. So what happens when I do? You know, are there thoughts? Is there some circumstance that occurred prior? Okay, lastly, I have a shameless plug to make. My second book, which is on body dysmorphic disorder, some about my own personal story, as well as stories of my clients. And it's meant as a treatment guide as well. But one of the reasons that I show this is to highlight the cover. When the editor first showed me the cover, I was horrified. I said to her, can't you put something more positive on that? Why does it have to be this zombie-like creature? Well, I thought about it, and then I realized that it is the right